My name is Ariane, and this is my Module 1 assignment. So I made this very bad lung detail, so I don't know if you can see it, but as you pull down, the lungs do inflate, and as you go up, the lungs deflate. So for question 1, when we inhale, we're breathing air from the outside into our lungs. During inspiration, the diaphragm and external intercostal muscles contract, causing the rib cage to expand and move outward, which expands the thoracic cavity and lung volume. This creates a low pressure within the lungs than that of the atmosphere, causing the air to be drawn into the lungs. We need to always remember that gas flows from an area of high pressure, so and then to one of a lower pressure. So as we can see, high to low, and it inhales and exhales. So when we breathe out, we're pushing air out of our lungs. So the air inside our bodies are coming out. During expiration, the diaphragm and the intercostal relax. This causes the thorax and the lungs to recoil. The air pressure within the lung increases to the above pressure of the atmosphere, causing the air to be forced out, so that you have an increase of that air. So again, just to show you. So a couple of reasons why some people have a smaller or larger lung capacity is a person's height. If you're taller, you may have a larger lung capacity. So also geographic, like where they're located. So people living at high altitudes tend to have larger capacities to compensate for the lower atmosphere, so the pressure in the air. Lifestyle choices, so people who are obese or smokers tend to have lower capacities and higher rates of ventilation, and then of course disease, so COPD, lung cancer, things like that. So to describe how asthma affects the lungs, so inflammation results in bronchoconstriction and airway hyperactivity, and also edema in the airways. So asthma can cause resistance in the lungs as it changes the size of the airways. This is because asthma causes the inside of the airways in a patient's lungs to become inflamed and swollen. It can also cause them to secrete excess mucus, which all results in their asthma attacks. So this is why it's difficult for them to breathe, because they have very small airways, and then it's clogged up with all this mucus. So they'll start experiencing signs of like wheezing, breathlessness, chest tightness, a really like deep cough, and it usually happens in the morning or anytime they have a trigger, things like that. So what are the priorities of a person who's in an asthma attack? The priority for this patient with asthma or an asthma attack is to maintain their oxygen levels and control their symptoms. This is done with many medications such as anti-inflammatory drugs or bronchodilators. These aid to relieve the swelling and dilate the bronchioles to get oxygen in the patient. You can use drugs such as steroids, so corticosteroids, phosphodiesterase inhibitors, anticholinergics, B2, andrenic angustias. The nurse needs to monitor the disease to make sure that the patient isn't getting worse, teach them how to control the disease. This means performing focus assessments on their lungs and their hearts, and monitoring their vitals, especially their oxygen level. So what's important to teach the patient with asthma? So the nurse needs to educate on how to use the medications and devices such as inhalers and PFTs. She should teach on how to establish triggers, maybe keeping a journal of when the patient experiences more symptoms and side effects and things like that, and note what the air quality is and things like that, or what they were around if they were outside or if they were doing any types of sports. The nurse should also teach on a good diet. It's super important for people who have any type of disease to have a better diet and to also stay active, even though they do have asthma and it could be causing them exacerbations. You still need to stay active. The nurse should teach how to perform pursed lip breathing. This will help them in asthma attacks to get more air in. And lastly, the nurse should always teach on what to do in a medical emergency. And then lastly, so what community resources are available to people with asthma? So there's a ton of them actually out there. You can find them online. The Allergy Foundation of America is one, American Lung Association, National Heart and Lung and Blood Institute. The CDC is a great resource, the American Academy of Allergy and Asthma, and then the American Thoracic Society. So those are all really great resources that a patient with asthma could use to help them, control their symptoms and just learn more about the disease.